Oh, worry. That's all you do is worry. I was waiting my chap at the door. And I got my trap at the door. The second time I got a phone call, but the first time was my chap at the door, and that's what you wait for. You wait. I mean, I go to my bed at night with my clothes on, because thinking it's going to come during the night. Bad news comes during the night.
This is one of the most popular lanes, which isn't far from the pharmacy we just visited, where people will come to prepare and inject their drugs. So you can see it's very close to one of the busiest streets in Glasgow city centre. So what we'd like to do just now is just take you up the lane and show you that environment.
You felt horrendous, you felt you were dirty. Like, that's the way I can describe it. You felt you were a dirty person because you were doing this outside, but that craving and that feeling that you needed that drug in your body, that totally takes over any judgment that you might have to being aware of people might see you, or feeling ashamed that people might see you or anything like that.
Yeah, as you can see, the area here is just littered with needles, syringes and used paraphernalia.
You're kind of scurrying about the streets like a wee rat. Like, that's the best way I can describe it. You're like a rat. You're getting into all these wee hidey holes to do the worst thing that anybody who didn't have addiction issues or anything like that, if they witnessed that, they would think you were the worst of the worst.
But it's very isolated. You know, I feel if somebody overdosed, for example, in a car park, they may get discovered by somebody coming in there. But here I think is totally different.
Our experience of people, nobody wants to inject in public. We've got to understand addiction as an illness, and we've got to try and look at that treatment and care for people in a much more in-depth way.
If I knew that there was somewhere instead of like a lane to go down or a park to sit in, or because I don't like that. See, if there's like children and families and they're walking past, I'll never ever inject where I know that a child can see me.
So I think when you accept that the locations people are using, you know, are out of sight of the general public, you know, they're actually going to great lengths in order to make it as private as possible. I think that could be one of the major selling factors for a new facility. You know, giving someone a real safe, warm, well-lit, secure environment to prepare and inject their drugs.
But if there was a safe injecting space for me, you bet I would use it, especially if there was other services there that I could tap into as well.
You can see the booth is very well lit, it's very hygienic, it's cleaned before and after every use, and they'll sit in this chair and use their drugs, inject their drugs here. So we're currently in the injecting area of the Enhanced Drug Treatment Service, and you can see there's 4 injecting booths here. In the new safer drug consumption facilities, there'll be similar, perhaps not identical, but similar booths, and more of them. And as you can see, they're a clean, hygienic environment in which people can use the drugs that they bring in themselves. And standing where I am will be staff, nursing staff in particular, who will be able to advise on safer injecting and will be able to intervene should any problems arise.
The safe drug consumption facility takes away that feeling of shame, gives a place where not just people with an addiction will be, but a whole range of different services will be.
I'm part of the women's reference group, and we're like helping to put towards like the design and the structure and stuff of the safe consumption room, and we're also getting our opinions across to see how we think it should be run. So we're finding out quite a lot of information about the different services that are going to be in there, like GPs, nurses.
It also gives us an opportunity to engage with people in terms of their wider treatment, care and recovery needs. That might be anything from starting drug treatment to seeking support around housing or improving their benefit situation.
Especially people that are the RSVP, the rough sleepers and vulnerable people, they're kind of on the fringes of society a wee bit. They'll know what services to tap into. Unless they go to places, let's say the Simon Community or Glasgow City Mission, where there's recovery workers that will help them tap into services. A lot of them will not take up on homeless accommodation or seeing a doctor or seeing a psychologist or a dentist. So it would be really good if they had somewhere that they knew somebody was going to tap into to safely inject and have all these other services there for them to tap into at the same time.
That's the most important thing, not just to get, the rooms are great to keep them safe, but it's getting them other help, to have other people. Do you want to speak to somebody today? Or are you having a really bad time? And then it could follow, and I would like to think that could happen.
So working in partnership with other services means that we're all aware of what each other does, and we're all able to offer the services of others and know where to direct people if they need anything from any other service. So it really helps to all be based together so that we are able to provide all of these services under one roof and make it as easy as possible for people to access lots of different aspects of healthcare.
So we're currently in Hunter Street Health and Social Care Centre, where a whole range of services for people who use drugs already exist, and we hope to implement the safer drug consumption facility in this building. This building is well known to the target population. It's also a building in which they will find a range of other services that we can offer them, but also very importantly, it's relatively short walking distance from a number of public injecting sites that we're aware of.
If we have a safe space where we can go and inject and stuff like that, then it's going to stop people injecting in your back bin shed up your close. You're not going to be going out and finding needles and stuff like that. So I think it's important to get that out there as well, to let them know that this isn't just like lots of money getting piled into yet another drug service. This is for the whole community.
All the corners that he went to get drugs, he got hepatitis. He was one of the ones that used bad needles. He would have took a needle off anybody to do what he was doing.
So I think it'll have a massive impact in this population, and from our work, and especially in terms of the bloodborne virus transmission, so HIV and hepatitis C transmission. What the Safer Drug Consumption Facility will be able to do is offer a clean and safe environment for people to inject drugs, but also to be able to access clean and sterile injecting equipment for every injecting episode that they have. So that will take away the risk of acquiring a bloodborne virus, because they will not be sharing any injecting equipment with other people.
With any vulnerable group, there is stigma is probably the number one thing that I come across. So they don't like coming into a traditional healthcare setting because they do feel stigmatised with that. So I think that's a key barrier that maybe isn't discussed enough. It's always a barrier with HIV, it's still a barrier for hepatitis C. I think any kind of environment where people feel welcomed, where they don't feel stigmatised, will help for sure.
So over the years, I mean, it would take months to tell you some of the horrendous stories and how drug addicts are treated. Who would ever have thought there would have been a place for addicts to go and inject themselves? Nobody, I never ever thought that would ever happen. But I think myself it's a marvellous thing. Just through speaking to my son as well, where he's told me where they had to go sometimes, how many people use the same needle sometimes, and so I would say it's a great thing. Apart from people not getting hepatitis, the amount of deaths, I'm quite sure this is going to definitely, but hopefully it'll help.
You lost your mother, you lost your father, your grandparents. That's the way it should be. You shouldn't lose your children. That's not right. That's just not the way it should be.
I think recovery, for most people, or abstinence is most people's final step, your final step in the journey. But it's important that we keep people alive long enough to at least have an opportunity to reach that goal. And working with a harm reduction ethos will give us the best possible chance that ensuring that people are at that stage, then they reach it with the least harms caused as possible.
It's like, we will meet you where you're at. There's no judgment, there's no criticism, there's no forcing treatments or services upon the individual. It's just accepting somebody for where they're at and building those kind of relationships.
Because people that have been in active addiction and are long-term in recovery are kind of a godsend to me, because I can bounce ideas and they can relate to stuff that you've gone through because they've been through it themselves.
the importance of having that one person who accepts you and can really, help you to make those decisions about what you want in your life or what you want your kind of journey to be from that point on.
You need to make the choice, and it's important what their choice is heard.
These things, I think they're often called a lifestyle choice, but people don't choose to be in this situation. People don't choose to be, for example, an alcoholic with liver disease, or people don't choose to have lung cancer because they've been a smoker. And I don't think it's any different. The difference is the criminality aspect to that.
They feel as if people care, and maybe they're not alone.
When you're cured of everything, but it would have been a bit of comfort, I suppose, of knowing that if anything did happen, somebody would be there to help me.